and welcome to Cellular Healing TV. I'm your host, Meredith Dykstra, and this is episode number 184. We have our resident cellular healing specialist, Dr. Dan Pompa, on the line, and today we welcome a very special guest, Dr. Jason West. And I have to tell you guys, I think this episode is going to be all over the place today because Dr. West has an expertise in a lot of different areas. So this is going to be a really interesting conversation with a lot of different cutting edge therapies he's using to get his clients well. So before we dive into the conversation, let me tell you a little bit more about Dr. West. As a fourth generation healer and a world-renowned integrative medical physician, Dr. Jason West believes in providing exceptional healthcare to his patients. With 2 doctorates, published studies, a fellowship in healthcare disciplines, a doctorate of medicine in progress, and over $1 million in continuing education, Dr. West's knowledge and training is unmatched. Dr. West's expertise spans IV therapy, prolozone therapy, neural therapy, chiropractic care, natural medicine, energy medicine, stem cell therapy, hyperbaric oxygen therapy, nutritional therapy, and oxidative medicine. Wow, did you get all that? The West Clinic is frequently a last stop for sick and exhausted patients who do not fit the typical medical model and have been given up on by the medical establishment. Dr. West has lectured at conferences all over the world, and in addition to the integrative chiropractic, naturopathic, and acupuncture conferences, he's taught over 50 individual seminars for doctors on topics such as clinical nutrition, blood chemistry, and chronic disease. Countless individuals have benefited from the compassionate care rendered by Dr. West at the West Clinic. His thirst for knowledge urges him to continue learning to further his abilities and skills. With the belief that he can help any condition, Dr. Jason West is committed and dedicated to his calling in life, which is to heal. So welcome to Cellular Healing TV, Dr. West. We're so excited to have you.
Thank you for having me.
Yeah. Well, hey, Doc, you definitely, I did a Facebook Live, and I told the world about what one injection, and most people it takes more than one, I'll say that now, of your prolozone therapy, in which we're going to talk about on the show, but it transformed my back almost immediately, and I was so impressed. And I want to start a unique place here because I was also impressed when I saw the pictures of your father, his father, his father, 4 generations of you all in natural medicine. So start by talking about that because I think it's part of your greatness, man. Tell us about that.
Well, my great-grandfather started our office, a second career, was a traveling violinist and migrated here from England, and his wife was always sick, and my great-grandmother Alice, and he took her into a newfangled doctor in Ogden, Utah, I want to say like 1910, 1911, and he was a chiropractor. And the chiropractor really helped get my great-grandma's health back together. And my grandfather always said, if I had my life to do over again, I want to be a chiropractor. And so he got the opportunity in his mid-40s, left his wife and 7 or 8 kids in Pocatello, Idaho. That was their last stop. That's why we have our office here. Yeah. And traveling around the West, performing the violin, and eventually got enough money, went back to Chicago, got his doctorate, came back and started treating railroad spine. And railroad spine is what, they don't have it anymore, but what happened was they'd have these railroad cars, they didn't have any bumper or coupling mechanisms. And so what happens to hook up the cars, they just take the locomotive and ram it into the cars. It was like having a car accident every day for the conductors and the engineers on the train. They'd have these terrible backs, and he got this reputation of taking care of difficult, quote, railroad spine. And then he had some really good outcomes from the worldwide flu in 1918, 1919, and we started taking care of, chronic complicated conditions almost, 97 years ago. And so much of what we do in the office, my grandfather taught my grandfather taught my dad, and my dad taught me.
Yeah, I gathered that too. And I think you added your expertise. You kind of went through each picture with me, like he was an expert in this, he was an expert in this, and, all the way down to you. And you have become, Jeff Hayes is a mutual friend of ours and someone who you helped as well. Jeff Hayes is, for those who don't know, he's a producer of many different health documentaries. And he described you as Michael Jordan with the needle. And he, said, Dan, you got to go see Jason, right? And so I said, okay. Oh, someone's ringing my doorbell. Sorry. But I said, okay, I'm going to go. You really made a difference with him. Anyways, people come from all over the world, just because your ability to hit certain areas, you have this, you described it with me like this. You said, basically, you gave the analogy, I'll let you tell the story, but of the guy that comes in and just taps the, the right area and says, oh yeah, okay, that was $50,000. You don't charge that much, but the analogy is he hit the right spot. Tell that analogy, because that's part of your brilliance, man. I mean, you have the ability to hit the right areas with some of these injections, and we're going to talk more about those injections in a minute.
So the story we have is that, they had a plant that breaks down, and everything's dependent on, this big, piece of machinery in the middle of the plant. The plant owner calls the mechanic, and the mechanic shows up, and he looks around the machine for a little bit, and he takes out a little hammer, and he taps on the machine. All of a sudden, the machine starts working, and he says, give me an invoice. And so the guy gave me an invoice for $50,000, and the guy was like, oh my gosh, why would you charge that much? Break it down for me. And so he's like, $10 for travel, $10 for gas, $49,970 knowing where to hit.
Yeah.
And I've been really, really, I love continuing education. I always am going to something, and just, it's one thing to learn anatomy in school. When you're working on your cadaver and you're kind of humdrum, but when you've been in practice for a while, and then you get the opportunity to go work on cadavers and go be in a cadaver lab and really knowing where things are going and where they're located, and then getting to that spot with a therapeutic application of a natural vitamin injection literally turns people around, and it's life-changing.
Yeah, no doubt. Let's talk about the prolozone therapy, what it is, what you do different. That's what helped me. So tell them about that, because there's a lot of people right now with chronic conditions and pain that could really benefit from this.
So this fits underneath the umbrella of what we call regenerative injection therapy. And the idea behind regenerative injection therapy is we want to stimulate your body to heal itself. It's the polar opposite of cortisone therapy. So in medical treatment, if you have a painful condition, and I always give this analogy, and I'm kind of joking and I'm kind of serious with patients. If you're driving down the road and you look down at your dashboard to make sure that you're going the speed limit and other things, and all of a sudden you see your oil light show up, the medical treatment for that is, here's a black piece of electrician's tape. Just put it over the oil light. And cortisone, that's what it does. It removes inflammation. It takes away the body's warning signals or system. And I'm not saying that in certain times it may not be appropriate, but I do think it gets enormously overused. And you can't keep putting cortisone into an area. It'll destroy the bone. It'll kill the tissues. Right. Usually, 2, 3, and I'll have patients all the time. They'll say, I got a cortisone injection and it worked awesome for 6 months. And then I got another cortisone injection and it worked for a week. And then I got a third one and it didn't work at all. And what regenerative injection therapy is, we want to increase targeted inflammation versus removing inflammation. And the difference between using the prolozone therapy instead of taking pills is, if you take pills, sometimes it just gets disseminated through the whole body. You can't get the concentration gradient that you need in the area. But if you inject the area with something that stimulates it to heal, so our initial application is B12, some vitamin C, a little bit of paraminobenzoic acid, some 5% dextrose. And then you follow that, you leave the needle there, you follow it up with a little bit of oxidative medicine or ozone therapy. And the ozone therapy makes the body go into healing mode. So you put the building blocks there. The ozone therapy is like putting a construction crew in the area, and you can remodel tissue for things like bone-on-bone arthritis, tendinitis, tendinosis, chronic shoulder problems, meniscus tears, partial ACL, MCL tears. I mean, if it's completely torn, you can't fix it. But if it's partially torn, you can get those to heal.
Yeah, no, I mean, I noticed an immediate difference. And I'll have to say, I mean, you put these injections right into my sacrum and lumbar area, and I didn't even feel the injections. Honestly, I really didn't. I felt some expansion, some tightness, and you said that I might have some more discomfort in the next day, but I didn't really. So it was just after about a week, I would say, I told the story on the Facebook Live, literally, maybe it was 2 weeks at that point, but I literally went and picked up a 90-pound dumbbell, and I was like, I realized what I just did. Normally it would hurt my back, and it didn't. Even if I stretched, because I have this lumbosacral ligament tear, even if I was just stretching, like my hamstrings, which would normally help people in a low back, I'd be sore the next day. And, you know, I can actually stretch again. So, you know, I mean, you know, no doubt everything you said, I mean, it stimulated healing. And most people, okay, that was one shot, but you did tell me, I mean, most people need 3 to 5, maybe 3 to 6 of those shots because the healing continues. Is that correct?
Yes, and the difference between you and quote normal patients is a lot of times with normal patients, it's garbage in, garbage out. And because they're putting, you know, Mountain Dew and Doritos and Oreos in their system all the time, it takes more application of that targeted payload to get to that area to make it heal. Someone that's really into their health, it's, you know, their detox pathways are working, their building blocks are in their system. You can turn them around really quick because the body just needs a real nudge instead of a big overhaul.
Yeah, no, look, I mean, you have people fly in from all over the world, literally, you know, to get, you know, for your ability to inject them. You know, other people do prolozone. What are you doing different? Why are people flying in to see you for this?
Well, a couple things. One is it's just not the prolozone. And prolozone is one of the tools. And yes, we have, you know, our special admixture or special protocol for that. The other one is knowing exactly where to be and having just gobs and gobs of, you know, 15 years of experience doing it. But then the other thing is, you know, loading the body before. So when you come up, we're putting a bunch of vitamin C and magnesium. And I think one of the key minerals for ligament stability is manganese. If you have enough manganese, it actually acts like a shrink wrapper for your ligaments. And the ligaments hold the bones in place. And so many chronic arthritis joint problems are weak ligaments or loose ligaments. It's almost like taking a rubber band. If you stretch the rubber band as far as it can, and then you let go, it never goes back to its original shape. But that manganese combination of preloading the body with the IV solutions and doing some magnet therapy, some pulsed electromagnetic frequency, and the oxygen prolozone therapy, it's a combination of all those things, making sure that the body chemistry is balanced. And then, you know, I'm not surprised by miracles. I actually expect the miracles.
Yeah, that's fantastic. Well, I got one. So how does it differ? I mean, people may or may not have heard of PRP. Some of my viewers and listeners may have. How does it differ between PRP and stem cell, which, you know, we did a show on stem cell. I think it was, you know, released not that long ago. So, you know, kind of differentiate between these treatments.
Okay, so the 3 treatments, we have regenerative injection therapy, which could be prolotherapy, neural prolotherapy, peripheral nerve injection therapy, or prolozone therapy. All of those are designed to stimulate the body to go into healing mode. You want to control and stimulate inflammation. Inflammation makes you heal. Too much of it is bad. Too little of it's bad. So all of those are underneath the regenerative injection therapy module. I happen to be a big fan of prolozone. I think it works way better than prolotherapy or neural prolotherapy. It doesn't hurt as much. You don't need as many injections, and it's not as costly. Now, the PRP therapy stands for platelet-rich plasma therapy.
Right.
And essentially, you're taking platelets out of the blood, and you're adding it to your injection mixture. And some guys do it with drugs. Some people do it with, 12.5% dextrose. Other people add it to the prolozone. But it's basically, platelets are the scab in healing. So if you cut yourself, you have platelets that step in and make a mesh and make a scab. And basically, if you take those platelets out of the blood and put them into the area that's injured, they think that it stimulates and hurries up the injury process. When we do platelet-rich therapy at the office, I just don't usually go at first because I think the prolozone works so well. Usually 90% of the time, I can just use that. I don't have to use the platelets. In very advanced conditions, you can use the PRP therapy. It's getting more and more, accepted. And then the stem cell therapy, basically there's bone-derived stem cell therapy, there's mesenchymal derived therapy, umbilical stem cell therapy, or amniotic stem cell therapy. And, it's really the rage in functional and integrative medicine. And basically it's taking those stem cells that are going to differentiate into connective tissue and bone tissue and ligament tissue and stuff like that, and heal up the healing process. I've done a lot of work in the stem cell world. We do some umbilical derived stem cell services at the office, but I'm not sure you really need to do that. So many times you can just get people healed up with the prolozone, and it's only really the few and the resistant cases that need either PRP or umbilical therapy. And I do think it's we've taken something that I think has some neat applications, and everybody's doing it. It's turned into a great big profit center for a lot of people. And I just don't think you need to spend $5,000 or $8,000 or $10,000 on a back condition or condition unless the other therapies don't work.
Yeah, I mean, it is far more costly. That's for sure. And I agree. I mean, there's a time and a place for it, but I think these therapies that we're talking about need to be on the front end of that. For sure, especially just for the cost benefit a lot. And I agree. I think I've looked into it, the interview that we did, the umbilical cord or the placenta matrix is the effective and the safe way to go.
I agree.
Yeah. I mean, and I think it's similar. I mean, it just kind of stimulates the healing, I mean, I think, bone marrow it's a little invasive, I think, when there's these new other approaches. I think it's more effective. The fat, getting it from your fat cells is probably the least effective of them. And the umbilical cord, the embryonic tissue, that's a little bit controversial. So kind of laying it out there. But anyways, yeah, so let's talk about something. When I was in your clinic, you had a lot of books, and especially one that you actually wore out. You love a lot of these German techniques. One of which sounds very German, and it is, that my wife got twice. It's called the Frankenhauser technique. Now, we have a lot of women who watch this show, all right? And I know that many of them will benefit from this technique. Describe what this is, and describe the uses for it. It was developed in Germany. I don't know. I think you're the only one doing it here. Maybe there's one or two others. I don't know. But talk about that, the Frankenhauser technique.
Okay, so this technique is one of the magic treatment options for chronic healthcare conditions. And and I have no fear of doing it. There's no side effects, but it works awesome for headaches, for brain fog, for atrial fibrillations, heart conditions, breathing conditions. It's a magic for asthma, but it's also just phenomenal for female pelvic disorders. When I say female pelvic disorders, anything basically from the belly button to the mid-thigh, whether it's menopause, perimenopause, infertility, chronic urinary tract infections, chronic tailbone pain, sacroiliac pain. And basically the theory behind it is no one out there is really doing nerve reset therapy. And so where the idea comes from, or the story is that there was a doctor that his sister basically had a little scar on her finger, and out of desperation, he treated it with a little local anesthetic. It reset the scar, and it made all of her migraine headaches go away. It was a gentleman named Huneke. He had a son named Huneke. And there was basically a doctor later on named Dr. Dosch that wrote the Manual of Neural Therapy. And so it's really common in Europe. There was a French doctor that, Janet Travers, which said, hey, let's instead of calling it the German technique for neural therapy, let's call it mesotherapy or trigger point therapy. But what it does is it resets nerve memory. So how I describe it to patients is this. If you walk into your house and your spouse or your mom or your kids are making your favorite dinner, you walk in and you get that stimuli through your system. You're like, oh my gosh, that smells so good. I can't wait to partake of my favorite meal. And 20, 30 seconds later, you don't notice the smell because your nervous system has accepted that stimuli as normal.
Right.
Like it's stimulated. Then you forget something in the car, you take your dog out for a walk, you take the garbage outside, and you come back in, you're like, oh my gosh, that smells so good, because your nerves is reset. Well, so many times with chronic pelvic disorders or chronic fatigue, chronic illness, your body accepts the nervous system as that's normal. I just had a patient in here, she's been sick, she's 49, she's been sick since she's 16. And I said, your body doesn't even know what it's like to be healthy. because for 30 years of your life, you've been sick. So if your body was a computer, we called up tech support. Tech support would say, turn the body off, or turn the computer off, and turn it back on. Let's reboot the system. And I have this terrible joke with patients that I say, look, we can't kill you and bring you back to life. We have some unwanted side effects, and so and I joke around with people, but literally you can take a B vitamin, a little tiny dental syringe, and a needle, and you can go to different parts of the body and you can get the nerves to reset. You can get the spleen to reset. You can get the brain to reset. And so many times, and it's the magic treatment for women, the inferior hypogastric plexus, which basically sits on top of the uterus, was discovered by Dr. Frankenhauser in Germany. You get a nerve memory in the pelvis, and then you start getting these gynecological disorders and these interstitial cystitis and infertility. And if you reset that nerve impulse and you inject that nerve tissue, or right on top of that nerve tissue, the nerves open and then they close and they reset. And you can literally get the nerves to reset. And when you do that, many times it's like flipping a light switch. And you get instantaneous healing. It's like using quantum medicine, and they're healed.
Yeah, my wife was all nervous because the injections kind of go right into the pelvis area. I mean, I'm like doing this. You can't see where I'm doing. But anyways, and there's two of them, one on each side. And you know, it goes in pretty deep. So she thought surely this would be painful. Meanwhile, every woman in your office had this procedure. They're like, oh, it's nothing. We all got it because it's that, effective. Even the young girls there. And so, and then when you told me, okay, and it will increase her libido, I said, you're getting these no matter what. I'm going to hold you down. No, that's not really the story. But you did say it increased the libido, and I can attest to that was in fact true. So thank you again. But anyway, you're welcome. I like that. All right. I'm going to watch it. Meredith's going to jump in on me.
Gotta keep you in line, Dr. Pompa.
Yeah. So anyways, we better not give Meredith those shots, but no, they'll help you for everything. Good libido is healthy. That's it. It definitely increased, her hormonal health. And you know what? No doubt tightened up those ligaments, because, the funny thing is my wife going through, entering into menopause, she kept getting this low back pelvis SI thing going on, and she was doing everything. I mean, I brought her the best chiros, you name it. And it was still happening. I'm swinging her leg over the bike. It was just too, I said, she has ligament laxity. I said, this is caused by low estrogen, which is normal. I mean, low estrogen going into that phase is a normal thing. But I think hers was even lower for all of her lead issues earlier on in life. And you said, you know what? I agree. She needs this shot. And so, man, that was a gift too. There's another, and by the way, I have to say this other testimony. So we were in your IV room, and there was a gal, she was from California, and she had gotten, at this point, she just gets like one a year maybe of that shot, but she had a tumor that she described as the size of a softball. And those shots, she said, every time it was just shrinking and shrinking and shrinking. And that was the main thing she was doing, was the Frankenhauser technique, and her tumor just shrunk. So she encouraged my wife, oh my gosh, you want that. So anyways, that was something that probably you didn't know that actually happened in your IV room. You have a lot of devout believers there. So, my wife would never get Botox. And, but like most women at her age, she's concerned, about, aging, the skin, et cetera. She would never get fillers, Botox. You said, well, you need this cellular therapy that we do. And it's a homeopathic. You pull out the blood, it kind of resets the immune system. Describe that technique you do, because I've never heard of that either. I don't know if it's another German technique or what, but kind of describe that. And because you described how it would affect the collagen.
Well, so what we do is when I hear some new stuff, what I like to do is to figure out what they're doing. And I had heard about this doctor down in Mexico that was doing this, quote, stem cell therapy, unquote. And when I say it in quotes, phenomenal healer, really neat to process. But he basically was pulling out to blood, spinning it down, separating the plasma from the red blood cells, taking the DNA fragments out of the plasma, mixing it with the homeopathic, and injecting it into the person. And he was calling it stem cell therapy. And I just thought, well, I don't want any confusion with this, because I think it's more of a homeopathic autosanguineous therapy type, or a minor autohemotherapy, which means the self-treatment with blood. But it was interesting because I'm down at this healer's office, and I just think the world of him. And I said to him, if you teach me this, and if there's any possible legal way that I can do this in the United States, I said, I'm going to go back and I'm going to try and do it. And he looked at me for a minute and he's like, Dr. West, there's no shortage of sick people. Like, what's wrong with your mindset? Like, I'm going to teach you how to help other people. And so anyway, we came back, we basically, you take some blood out of the system, you spin it down, you separate the plasma, the red blood cells, you mix it with a homeopathic, and you literally can turn on a homeopathic stem cell activator or homeopathic cell activator, and you literally can help patients to reprogram their DNA. So you pull it out of the bloodstream, you put it back into the muscle system. When you pull it out of the bloodstream, it pulls out. It's almost like a self-cleansing mechanism, but it stimulates the DNA synthesis of different tissues. And I've had really good outcomes with type 2 diabetes doing this. I've had really good outcomes with chronic tendinosis when the prolozone hasn't stepped in, but it also seems to just really help people's connective tissue for aging, for wrinkles, for vitality. It's just introducing an activated DNA fragment into your system. It's your own tissue, and then basically it turns you on and puts you into repair mode.
Yeah, it's so interesting. Well, talk a little bit about I don't want to call them Myers cocktails because your cocktail is different. You had basically kind of mentioned this, to have certain nutrition up here when you do these injections makes all the difference. So talk about it, because this particular IV, you make it mandatory for every person that comes in, because it does kind of set the stage, or the core for that matter, for these other injections you do. So talk about that.
So I got into IV therapy because my dad got really, really sick in 2001, and chronic ulcerative colitis, bleeding from the bowels, eyes basically swelled shut. We thought he was going to pass away, and a doctor friend of mine said, "Hey, Jason, I think he might have scurvy." And I was like, "Scurvy? I mean, that was solved hundreds of years ago." And I'm telling you, he's got a GI problem. Well, putting everything back together, he had a mercury post underneath the crown. He bit into the crown. It shattered the crown. He swallowed some mercury, and he couldn't absorb any vitamins. And he literally had, scurvy in 2001. And we did some high-dose vitamin C infusion therapy, and we turned him around. I mean, it was miraculous. And that's why I went back to school, got a second doctorate so that I could do vitamin infusion therapy. And then I started learning about, the gold standard for infusion therapy, or the accepted treatment, is the Myers cocktail, which is essentially, vitamin C, magnesium, potassium, B5, B6, B12, and some calcium. And I think that's a great place to start. But there are so many things that you can add on top of that. And then I really started getting into Dr. Levy's work with the vitamin C. And I think that the Myers cocktails work really well, but you've got to get your vitamin C levels up. 5 or 6 grams of vitamin C, I think is nice for a little bit of boost, but I think the minimum is 25 to 30 grams of vitamin C. And in some of our, quote, modified Myers cocktails, we'll do up to 100 grams.
Yeah.
And vitamin C acts as an electron donor. And literally, I think how vitamin C works when you go through everything is it's the most powerful electron donor in nature. And people get sick because they run out of energy or they run out of electrons. And I know that's not an accepted medical diagnosis, but when people come in and they have cancer, they got fibromyalgia, they've got chronic Lyme disease, peripheral neuropathy, mixed connective tissue disease, it's because their body runs out of electrons. The body goes to different tissues and literally robs Peter to pay Paul. For some people, electrons away from the nervous system, or away from the muscle system, or away from the brain. And with the idea, we'll pay that back. And your body's kind of like a bank. If you have more electrons going in, you're going to be healthy, and you can have withdrawals and stuff. You can have energy needs, and you're going to be fine. But if the opposite is true and you have more energy needs than what's going in, now you're in a chronic disease pathway.
Yeah.
And vitamin C puts the electrons back into the body. And I have found that the more vitamin C, most of the time we get better outcomes And so you give 25, 50, 75, 100 grams. I've had some really sick patients with mononucleosis, with MRSA, with E. coli, that literally have been medical failures. We've saved legs from amputation by doing up to 300 grams an infusion. And when I tell that to doctors, they're like, that'll kill people. And I'm like, it doesn't. Because when you take the stomach and you put it into the vein, you can get like massive, massive payload, and it doesn't cause bowel problems. It doesn't cause kidney stones. It doesn't cause cirrhosis. It's just knowing what you're doing and how to deliver it. And so I love Myers cocktails. There's certainly way more out there than just those.
Yeah, no, well, probably ready to get on a plane. So I'll be out there. I hear my echo. Is that on my end or not? Anyways, Meredith, I'm going to turn it over to you because the cool thing is Meredith only has a million questions because she's thinking in her mind, I'm going. You're going to have a lot of questions. Most people watching this will have.
All right. I think, am I echoing too? Shoot. Okay.
Yeah,
Okay, I think
turn down your volume a little bit, perhaps.
All right. I think we're okay now. Actually, I don't know. I think it passed. But yeah, oh gosh, I mean, I'm so amazed by the variety of treatments you offered. I'm just kind of curious to step back, like when a new client, when a new patient comes to your clinic, how do you begin to assess them and what they need? Because you offer so many different things. So where does the process start?
Well, the process starts in basically the patient history and expectations. And I think I didn't learn this in school, but I think this is really important for everybody to understand, is there's a reason why people come into your office, and then there's the real reason why they come.
Yeah.
People will come into the office and they'll say, my shoulder hurts, I've got shoulder pain. But that's not why they come in. What they're telling you is, I've lost something. I can't golf, I can't fish, I can't put my arm around my wife, I can't lift up my grandkids. And so if you'll ask, like, what are your expectations and what have you really lost? And that's what you focus on. I think that's the most important thing. And the other thing I like to tell people is I say, look, this is my magic wand. Pretend I'm Gandalf or Merlin, and this is my wizard staff. Like, if I could fix one thing and you would go back to Pennsylvania or go back to Park City, what would it be? And then people will tell you, well, it's my back, it's my elbow, it's my stomach, it's my hormones. And that's where you start. But really the way you start, how do you help people, is it's the Humpty Dumpty protocol. People have fallen off a wall, they're in pieces, and when you put them back together, then what happens is their lives change. And so and one of my favorite things to do, walk me through a normal day of your life. What time do you get up? What time do you go to bed? What time are you eating breakfast? What is breakfast? What's lunch? What's dinner? You got to understand their lifestyle, because you can do some really neat things, but if you don't help them to take control and own their lifestyle, you're always going to be giving Band-Aid care. And then you walk through all the systems, and then there's no such thing as a low back protocol. There's no such thing as a heart protocol. There's no such thing as a Lyme or an MS protocol. There's a Meredith protocol. There's a Dr. Pompa protocol. There's a Jason protocol. There's a Mindy or an Anna or a Kim protocol. But everybody, you have to treat individually. And this is one of the difficulties when people will come in. I had a doctor call me from Louisiana and said, you treated one of my patients. They're doing really, really well. I want to maintain the therapy. How do I treat the patient? And the answer is, treat the patient. He's like, well, what's the protocol? And I said, well, it's not like taking 2 cups of flour and an egg, and a cup of oil and a little bit of baking soda and throw it in the oven for 350 degrees. Like, there's no cookbook medicine.
I couldn't agree more.
Wrong, address what's wrong, and then assign the appropriate therapy. And usually, Meredith, at our office, we never get easy stuff. It's always difficult. I'm putting my life back together from trauma or from cancer, or I've been everywhere else. And, I've been to the Cleveland Clinic or the Mayo Clinic or the Century Clinic, and I'm not getting better. And what you want to focus on is, again, what's wrong and how to balance the body through biochemistry, by detoxification, by hormones, and by biomechanics. And then if you do that, many times you'll get really good outcomes. And I say many times because I wish I could say everybody come to the office has gotten better. And that's not true. And part of it is we haven't caught people in enough time to change them. Some people don't want to get better, and then some people don't have the support either financially or through their inner circle to get better. So there's some barriers to healing that prevent those outcomes. But that's where you start.
Yep, I agree with everything you said. That's wholeheartedly, no doubt.
Yeah, it's got to be customized. And I'm wondering too, are there particular treatments that you use that you've seen the best results with versus maybe some of the others in your clinic?
Well, it's interesting because I'm not sure what the right protocol is for the right patient until you actually start working with them. So if someone comes in and they're like, look, I got a tendon problem. I mean, the natural thing is okay, let's go do some regenerative injection on that tendon insertion or the tendon origin or wherever it hurts, or let's work on the muscle body. And then if that doesn't turn around by direct application, it's more of a systemic or metabolic program. And so you've got to delve a little bit deeper and solve, I love that statement, totally cause them, which is understand and treat the cause. If you find the cause and you treat it, the body is this miraculous organism, this machine that basically can heal itself. If you get the right building blocks, you get the poisons out, you get the building blocks in, you get out of the way, and you don't, put people on chemical respirators. That's my way of saying you don't over-medicate them with prescriptions and create a dependency. You can really, really help people so that they can achieve and maintain optimal health.
Yeah, I agree.
Yeah, and I'm wondering too, maybe what are some of the outside therapies that you're expecting these clients to fulfill kind of on their end? So they'll come to your clinic and get all these different therapies on site, but what are some of the diet protocols, maybe lifestyle protocols that they need to maintain results?
So I used to think that the mind-body healing and, the biology belief and unforgiveness and all this other stuff was just hokey and it didn't make an impact. I'm kind of embarrassed to say that, but you're so accurate that if you don't have people change what they're doing, they're just going to end up back in the office. And whether it's me or whether it's the emergency room or a physiatrist or a physical therapist, and we're just doing Band-Aid care. So you have to empower people. And I think the most important thing is you start with them and getting them to communicate with themselves. I think that's so important. So I tell people, look, this doesn't cost anything. There's no magic bullet. There's no magic pill, but you need to like yourself. You got to communicate with yourself. Prayer, meditation, deep breathing. And my favorite thing to tell people and teach people how to do outside the office is journaling. If you will journal, it connects your right hemisphere, your left hemisphere of the brain through the corpus callosum. It strengthens up that pathway. You can learn you to communicate with yourself. I think that's the most important thing. The next most important thing is I have a sign in my office that says, if you are what you eat, are you fast, cheap, and easy? If you are putting junk in your system, it's like a computer. Garbage in, you get garbage out. And so we want to make sure that, you want to sit, when you sit, I have simple rules. When you sit down to eat, you should have a rainbow of colors on your plate. Some red, some green, some white, some orange. Skittles, Starbursts don't count. It has to be plant-based material. So you want to have a colorful diet. Anything you could eat 100 years ago is a really good starting spot because that gets rid of, Domino's and Arby's and McDonald's and all of the fast synthetic food. And then the next thing is water. Get lots of water. They always ask me, how much water? A lot. Drink a lot of water, healthy water. And then I love telling people, I think it's really therapeutic to get hot. If you're sick, to get hot for 20 minutes a day, preferably an infrared sauna or a wet sauna. You can do it in a bath or even a shower, but that helps to get, mobilize toxins. It helps to get your body so that your immune system kicks on. And so communicate with yourself, healthy foods, lots of water, get hot 20 minutes a day. If I can just get people to do that, enormous progress.
I love that. And so Dr. Pompa's the detox expert. So I'm curious, can you speak a little bit more about your detox protocols?
Yes, 1 second. Let me get my computer plugged in. It's telling me a bad battery. Hold on 1 second.
Low battery. All right, we want you charged up.
Okay, easy fix. All right.
Awesome.
Detox protocols. I love just cleansing the gut. And so I like to put people on, some cilantro. some chlorella, making sure that we have, I really like using okra to help to cleanse the GI system. I like to introduce them to heat deprivation therapy, was again, getting your body hot. You can do some ionic foot cleanses. And then the most important thing, which I forgot to mention, the other thing is movement. Movement and exercise is life. Get out and move. And if you're not used to moving, I don't expect you to go out and then run an Ironman competition or a marathon. I don't think that would be good for you if you have deconditioning syndrome. But moving and exercising consistently helps to mobilize toxins and poisons. And then my favorite thing, I love to use oxidative medicine, either rectal ozone therapy, where you take a little syringe or a catheter, insert it in the rectum up into the colon, infuse anywhere from 500 to 1,000 cc's of 35 gamma ozone, and it helps to detoxify the whole bowel. The colon is very, very absorbable, so you can actually get systemic ozone throughout the body. There's a wonderful researcher down in Cuba named Sylvia Menendez that has something like 78 or 80 different studies on using colorectal ozone to detox people. I also really, really like to do chelation therapy, primarily IV treatments, but also orally, because the chelation is essentially a protein molecule with 4 vinegar molecules on each side. And what it does is it binds up with toxins in your system, helps to pull them out through the primarily the kidney system. I think chelation is one of the most important detox therapies available. I'm 44 years old. I don't have any heart problems, but I have an enormous heart history, and I primarily do it preventative, but I love doing that to help people detox when appropriate. So water, heat food, lots of water, oxidative medicine, and chelation.
Hey, I told you this before when I was in there. You got to bring True Cellular Detox to your clinic.
I agree.
Yeah, exactly. Yeah, it will take everything to the next level. Well, and the ozone, I've heard more and more about, you do ozone, pulling blood out through ozone, but the rectal ozone, I've heard just how effective it is for multiple things. There's so many gut issues and gut problems, and it's very effective for that. Well, listen, Doc, thank you for being on. I know that we have so many people in chronic pain out there that are just going to resonate to the show, and give them how to get your clinic, give them your information, because many of them will want to get on an airplane and, get up there. That's for sure.
So you guys, my contact information is, the website is www.westcliniconline.com. I'm really also proud of the fact that I have almost 800 video testimonials of patients that basically are out of hope, out of resources, out of options. They're on my video blog called The Daily Dose Vitamin H. So www.dailydosevitaminh.com. And we have obviously we're on Facebook. We're in the booming megatropolis of Pocatello, Idaho, which people always ask. I've been asked multiple times, how come you're not in Chicago? How come you're not in Dallas? How come you're not in LA or Atlanta? And my response is, I like it here. I really like where I live. But West Clinic Online, Daily Dose Vitamin H, phone number is 208-232-3216. And I love working with people that have chronic unresolved conditions, because I really do expect miracles for them.
Yeah, absolutely. Thank you, Doc. Yeah, I'm sure you'll get some calls, no doubt about it. So
awesome.
Meredith.
Yeah, well, and in closing, so Dr. West, we kind of always like to end the shows with 3 key take-home points for our viewers and listeners to improve their cellular health. So what would be those 3 key points that you'd like to share?
First thing is to put your body on a schedule. I think bodies really crave order to schedule. Go to bed at the same time, get up at the same time, the more healthy and alive your food is, the more healthy and alive you are. Getting enough water, communicating with yourself. I think those are all lifestyle. I think it's really important for everybody to be on a liposomal or really absorbable vitamin C, vitamin D3, an essential fatty acid, and a mineral formula. And then the most important thing is communicate with yourself. And I think it's really, really important to have a healthy inner circle, and to make sure that you're giving back to the world, and forgive all. I believe that unforgiveness creates enormous barriers to healing, and I encourage everybody That doesn't mean you have to accept who's ever offended or bothered you, but if you'll forgive all, I think it's an enormous component of healing both the cells, the tissues, the organs, and the systems.
Boy, I agree with that too.
Amen. Awesome. Well, wonderful take-home points. Thanks again, Dr. West, for bringing all of your brilliance to Cellular Healing TV. Thank you, Dr. Pompa, as usual. And thanks, everyone, for listening, for watching. We're so grateful for you. Have a wonderful weekend, and we'll see you next week. Bye-bye.